Good morning. Thanks to the organizers for inviting us. I am Cristina Abadia. I am a doctor. I am the head of the Employee Health Service of Consorci Sanitari de Terrassa. It's a public hospital in Barcelona, in Terrassa, near Barcelona, and it's an integrated healthcare consortium. But today, I'm going to talk about my role as the Integrative Health Unit Coordinator and the President of the Integrative Health Committee. My talk will have 6 sections, and first we will see our beginnings. I would like to be very clear about this. Our stance has not ever been to put the patient in a crossroad, but rather offer them all the possibilities. We began in 2009 with an observational trial using an energy therapy with breast cancer patients after they received conventional treatment. It was authorized by the Ethics Committee. We started in 2010 and finished 2 years later, and the objectives were to reduce cancer-related fatigue, anxiety and sadness in breast cancer patients after they received conventional treatments. We contacted 52 patients and finally included 34. A consent form was required for participation, and we offered them weekly sessions for 12 weeks. The average age was 51 years old, from 24 to 76 years old, and we offered them sessions of 1 hour of duration about the subtle structure, and we did treatment about the non-physical aspects. And the results of this first clinical trial were these. Patients improved their quality of life and significantly, and reduced the levels of anxiety, depression, and fatigue significantly too. They experienced an improvement in physical and emotional aspects. After that, we visited different hospitals in UK that offer energy therapies. When patient arrives to receive a colonoscopy, endoscopy, or bronchoscopy, they offer the possibility to receive more or less 10 minutes of energy therapy so as to reduce the levels of anxiety. And after that, if the patient consents, the therapist offers them to be with them throughout the intervention. You can see here the head of the respiratory service, and on the left, you can see the energy therapist. And for me, an image is worth more than 1,000 words. This is me on the left, observing what's happening. In the middle, you can see the head of the respiratory service, and on the right, you can see the energy therapist. As you can see, all the complementary therapists have their own ID cards, just like the other healthcare professionals. And now we will move on to the second section. After all this, we could found our Integrative Health Committee. It was set up to promote integrative medicine and to raise awareness about what it is. We have done different sessions, workshops. You can consult everything in our website. And we offer specific courses for healthcare workers in our hospital about integrative oncology, scientific base of integrative medicine, mindfulness. And we also are doing in Terrassa School of Nursing an obligatory subject for university nursing students in their final year. This subject is about non-pharmacological techniques for management of stress and pain, and the main contents are these: how the language I use can affect patients, the way our own unresolved grieving process can negatively impact our relationship with patients, and the different parts of the non-physical structure or aspects. It includes a practical training in mindfulness, polarity therapy, and energy healing. For example, this is me in one of the sessions of energy healing. I am explaining them the different parts of the subtle structure. After that, and we will move on to the third section, we founded our Integrative Health Unit in 2017. I would like to say that the unit receives no funding and relies entirely on health professionals volunteering their time. I think this is similar as United States, as we saw it yesterday, I think. And apart of not receiving any funding, the board of directors stipulated 3 conditions. All of us, we have to be healthcare workers. Our activity is outside of the normal working hours, and we have to do research. There are 20 of us running the unit. The majority of the patients come from the oncology department, although the last year there are other departments that have begun to refer us patients like hematology, traumatology, and primary care. The unit has 2 parts: the inpatients, where we offer energy therapy, specifically Reiki for inpatients, art therapy for non-oncological patients, acupuncture, and we will begin with music therapy next November. But today I'm going to talk about the outpatients. We visit in the outpatient clinic and in the oncology day hospital, and we offer nutrition, mindfulness, acupuncture, and 2 types of energy therapies for outpatients, which are polarity therapy and energy healing. And next year we will begin with art therapy for oncological patients and yoga. This is the multidisciplinary team. There are 3 doctors, including myself. I do the first and final visits and offer energy therapy and acupuncture. We have a nurse, a physiotherapist, psycho-oncologist, a nutritionist, 3 art therapists, and other 10 healthcare workers who offer Reiki specifically for inpatients. This is a session of mindfulness with our psycho-oncologist. And about nutrition, we do a first visit in groups from 6 to 8 patients, and the following visits one-to-one with the specialist. This is our acupuncturist, Dr. Dalmau. I love Dr. Dalmau because of the way he treats patients, and sometimes he treats families too. And with acupuncture, we're treating cancer-related pain, chemotherapy-induced nausea and vomiting, peripheral neuropathy, cancer-related fatigue, and hot flashes. This is Dr. Garcia, who offers polarity therapy in the outpatient clinic. And the therapy in the convalescence unit in 2018, we visited 173, I say people because they visit patients and families too. And this year, from January to June, we have visited 144 people. The specific objectives of this intervention are to reduce the state of stress and anger, increase tools for the acceptance of the disease, and develop resources related to frustration and uncertainty based on the use of artistic materials, and so as the patients can express feelings and emotions. How does our unit function? When the patient visits in the oncology department, if the oncologist considers that they can benefit from our treatments, they refer us, the patients, to our unit through the clinic history. We write down in the clinic history of the hospital like any other specialties, and I do the first visit with the patient. With the input from the patient, I decide which therapy would be most effective. We offer from 6 to 8 sessions per therapy. Perhaps we begin with nutrition and acupuncture if pain is important, and after that I do the final visit, and maybe they have appeared spiritual needs or some other questions, and there we offer them an energy therapy. The fourth section is about the results. The objectives were to improve the quality of life and reduce anxiety, depression, and cancer-related fatigue through an observational trial evaluating pre- and post-intervention using different questionnaires, a general questionnaire, socio-demographic data, and different scales about anxiety, depression, quality of life, and the visual analog scale. Here you have the total of patients we have visited in total from 2018, 299 patients. In 2017, we visited 97 patients. In 2018, 108, and from January to June of this year, 94 patients. And on the right, you can see the total number of sessions we have offered them. About the results with the limited resources we have available, we have collected data on 60 of them. The average age is 57 years old, 77% are female, and look at this, 49% of patients had used CAM previous to their illness. As you can see, we have visited different types of cancer patients, and all of them had received conventional treatments when they arrived to our unit, and the time between diagnosis and the initial visit for CAM treatment was less than a year in 54% of patients. 29% of patients received polarity therapy, 33% energy healing, 60% acupuncture, 67% nutrition, and 10% mindfulness. As you can see, many patients received multiple types of therapies. And these are the results. In the blue color, you have the levels of anxiety and depression before CAM treatments, and in the red color, the levels of anxiety and depression after receiving treatments. You can see the levels of anxiety and depression reduced significantly. And the same for quality of life in different aspects, overall and emotional aspects, and the same for the levels of fatigue significantly too. Other aspects like appetite and other aspects about quality of life, diarrhea, nausea, and insomnia improved, but not significantly. They perceived an improvement in physical aspects. You can see in the red color quite a lot improvement, and in the green one a lot of improvement. And for emotional improvement, quite a lot improvement in red color, a lot improvement in green color. All patients would recommend CAM therapies. Just the fifth section, just a glimpse about integrative health around the world. You can see here that the most prestigious universities and hospitals around the world offer integrative medicine. The Society of Oncology, Integrative Oncology, has a clinical practice guidelines for incorporating complementary and integrative therapies into conventional clinical practice. And let me stop one moment here, because energy therapies are the most difficult point in my hospital to be accepted by other doctors. But if, as you can see here in these guidelines, they say that we have to explain patients that we don't know how energy therapies function and that they don't have an anti-tumoral effect, but they can be very useful for stress and pain and other aspects that patients have. After that, the American Society of the Clinical Oncology endorsed these guidelines of the CEO. And look at this about the WHO Global Report on Complementary Medicine of this year, 2019, about the member states with national laws or regulations on complementary therapies. You can see here the green color, the states that have a regulation. Please focus. I don't know if I can. One second. Please focus on the pink color. And the same for the states with the national programs on complementary medicine. Again, please focus on the pink color where we are, and I think we are going to be. And the states with National Office for Complementary Therapies. We are in the pink color too. So, the final section about the future, I don't know if we are going to have a future, but so we are going to present these results and our units in the next CEO conference next October in New York. And next year, we are going to begin to offer yoga, music therapy, and art therapy for oncological patients. And if our government allow us, we are going to do a clinical research with patients with chemotherapy-induced peripheral neuropathy, with using acupuncture and manual therapy, with an electromyography pre- and post-intervention. It has been accepted by the ethics committee. And I want to finish, to be very clear, to make our position very clear. We don't support alternative therapies without conventional medicine. For us, medicine, conventional and integrative, because for me, medicine is one, should be like a balance between science, knowledge, and research, combined with compassion, empathy, and love for our patients. Thank you very much.